Hello, everyone, and thank you for attending this training on understanding nicotine replacement therapy and medication-assisted treatment. We're excited to have you with us today, and we hope that you enjoy your time with us. Please take a few minutes to read this disclosure and acknowledgements. All references in this presentation to tobacco and tobacco products are referring to commercial tobacco and not the sacred and traditional use of tobacco by American Indian communities. Let's go ahead and get started with the training. So today, my name is Natalie Pena, and I have been working in tobacco prevention for over 7 years. I recently received a certification as a tobacco treatment specialist. In addition, I formerly worked at the American Lung Association in New Mexico as the director of programs, where I managed a statewide initiative on smoke-free living. You will be meeting Rebecca Padilla later on in the presentation. For now, Rebecca is the National Manager for Tobacco Programs for the American Lung Association. She's managed national projects that offer expert and technical assistance to tobacco control, health systems, and community partners to further health systems change efforts that integrate evidence-based tobacco use dependence treatment and clinical and community health settings. She's certified tobacco treatment specialist as well, and she has served as a content expert for the American Lung Association and partner organizations across the country. We're really excited to have her here with her expert knowledge and wisdom, and she will be sharing as soon as I'm done with the beginning of this presentation. So today's training objectives, we are going to identify the different nicotine replacement therapies that are available, the amount of nicotine per nicotine replacement therapy, the proper use of nicotine replacement therapy, and the side effects of various medications, which Rebecca will be going over after we go over these objectives. Also, at the end of the training, you will be able to identify different types of FDA-approved nicotine replacement therapy, understand assessment and dosing recommendations for effective treatment for nicotine replacement therapy, explain the proper use of nicotine replacement therapy, explain what to expect with various nicotine replacement therapies, explain the potential side effects of nicotine replacement therapy, and explain what medications must be prescribed and why. And then explain what nicotine replacement therapies can be purchased over the counter, and understand combination therapy and how you can use nicotine replacement therapy with in different combinations. So before we jump in, I would like to suggest, if you haven't already, to take the brief interventions training. This training works in congruence with this current training we're doing today. Here's what we covered in the prior training. So we covered in our last training the 4 A's, ask, advise, and refer, AAR. Since quitting smoking is a multi-layered process, both behavioral and physiological, we cover the physiological process and how to use nicotine replacement therapy in quit attempts, but also the behavioral piece. And you'll hear a little bit more from Rebecca on her presentation, how the behavior piece in conjunction with the nicotine replacement therapy yields the best results for people to quit and stay quit. So I highly recommend that you go back to that training and that you take a look at it. We also offer CEUs, so you're able to get more CEUs through that training as well. And we do go over a lot of scenarios in the behavioral health setting of how to support others as they are quitting or going through their quit attempts. So now we're going to have a word from Rebecca.
Hi, my name is Rebecca Padilla. I am a certified tobacco treatment specialist, and I am the national manager for tobacco programs at the American Lung Association. I'd like to start out today by talking to you about an overview of the tobacco and nicotine use here in New Mexico. Let's think about how do we compare to the rest of the United States. So the adult smoking prevalence rate in New Mexico continues to track closely to that of the US rate, with about 1 in 6 adults smoking. In New Mexico, adult smoking has declined significantly from 21.5% in 2011 to 17.5% in 2017. And we can attribute that to the great work of the Tobacco Control Program here in New Mexico and other amazing partners across the state working on strategies to reduce the toll of commercial tobacco use in our state. In 2019, 37.5% of New Mexico high school youth reported currently using a tobacco product, and that includes e-cigarettes. Among New Mexico high school students, 8.9% reported currently smoking cigarettes. $1.1 million was received from the CDC for tobacco prevention and control activities in fiscal year 2020. 16% of adults smoked cigarettes in 2019. 2,600 New Mexicans die every year from smoking-related illnesses. And that equates to about $844 million spent on healthcare costs due to smoking in 2019 alone. However, those reports also present findings that underscore the challenges we face to further reduce smoking. Over 40% of adults who smoke do not receive advice to quit from a healthcare professional, and that includes behavioral health specialists. Fewer than 1 in 3 adults who use cigarettes use smoking cessation counseling or an FDA-approved quit medication when they try to quit. And fewer than 1 in 10 US adults successfully quit each year. Although a majority of people who make a quit attempt, less than 1/3 of them use cessation medications that are approved by the US Food and Drug Administration. That's the FDA. Nor do they use behavioral counseling to support their quit attempts. Now that we have a better understanding of the landscape here in New Mexico when it comes to nicotine and tobacco use, let's also, recognize those challenges we face and move on to talking about the chronic relapsing condition that we refer to as tobacco and nicotine use dependency. Nicotine is a drug that is a stimulant, meaning that it raises levels of physical or psychological activity in the body, and it's toxic at high doses. When a person uses cigarettes, e-cigarettes, or other commercial tobacco products, nicotine is quickly absorbed into the body and goes directly into the brain. According to the Surgeon General, adolescents are more at risk for developing long-term effects to the brain from using nicotine because the brain isn't fully developed until the age of 25. I want you to remember as we go through this training that nicotine is as addictive as heroin. Nicotine causes physical dependence characterized by withdrawal symptoms upon cessation. People become dependent on this drug to regulate their moods and their emotions. It's really important to consider that the addictiveness of commercial tobacco products is not an accidental coincidence. Rather, the use of nicotine in tobacco products is a choice made by the tobacco industry, by their executives, to ensure that consumers get hooked and stay hooked on these addictive products. From a business standpoint, having customers that are addicted to a product ensures that they have customers for a long time, or at least until they succumb to one of the chronic illnesses that is at root caused by tobacco dependency. I'd like to take a moment and also talk to you a little bit about synthetic nicotine. So nicotine is primarily found in tobacco plants or other plants that are related to the tobacco plant. However, synthetic nicotine is created in a laboratory and is not derived from tobacco. It's become increasingly popular recently, and a new paper from Stanford University has identified 6 manufacturers of synthetic nicotine and 98 brands claiming to contain synthetic nicotine. Many e-cigarettes, their makers that used tobacco-derived nicotine have recently switched over to marketing their products as containing synthetic nicotine. So they've really done this as a means to avoid regulation by the Food and Drug Administration. This would allow them to exploit a loophole and keep selling the types of sweet and fruity flavored products that ignited the youth vaping epidemic that continues on today. Fortunately, though, that loophole's closing, but it's important to be aware that nicotine is both contained in tobacco and tobacco plant products, as well as synthetically manufactured in laboratories. So, as I mentioned, nicotine is highly addictive. What that means is the human brain can develop such a strong dependence on the drug that the nicotine user can no longer control their desire or their smoking behaviors. The cycle of nicotine addiction starts with bringing nicotine into the body. In this case, it might be from inhalation of cigarettes, a hookah, a cigar, e-cigarettes, vapes. It might even be absorbed through the mucous membranes with snuff or snus. But the important thing to remember here is that it's not just a physical addiction, it's physiological and behavioral. Let's look at physiological addiction first. So that's the addiction to the nicotine. It requires treatment, and that treatment is medication-assisted treatment for recovery symptoms. And we'll talk about that a little bit more later in the training. When we look at the behavioral aspect of commercial tobacco and nicotine dependency, we're talking about the habit of using the nicotine-containing product, which also requires treatment. And that treatment is evidence-based behavior change programming. This really makes up a comprehensive treatment plan that addresses both the physiological and the behavioral aspects of addiction. And it's really important to keep that in mind when we are trying to help people quit, no matter what product they're using. So let's talk about the physiological impact of nicotine and tobacco products. So nicotine mimics the structure of acetylcholine, a neurotransmitter in our body, and it binds to wherever there are acetylcholine receptors in the brain. However, since nicotine isn't actually acetylcholine, it affects acetylcholine binding, and it prevents it from doing the job it's supposed to do in the brain. Nicotine rewires and changes a person's brain, especially a young person's brain, making a person anxious when their brain is going through nicotine withdrawal. Nicotine doesn't just affect the brain, though. Since there are acetylcholine receptors all over the body, it impacts every system of the body. So a few of these to consider. For example, using nicotine can make your heart rate increase, and that really activates the fight or flight response. And this can really exacerbate that feeling of anxiety for people that have generalized anxiety disorder, or can create a feeling of anxiety for those that don't have that disorder. Nicotine salt solutions in particular produce a faster and higher heart rate than other aerosolized nicotine solutions, which can put stress on the heart. Outside of all of the chemicals and toxins already in e-cigarettes and cigarettes, cigars, nicotine can independently cause trouble with breathing and damage to the lungs. The lungs generally produce mucus and a cough in response to harmful chemicals inhaled. Nicotine can also cause an increase in acid in the GI tract. This can cause or exacerbate acid reflux. And last but not least, the nicotine can even negatively impact the reproductive organs, as well as the kidneys and bladder. Nicotine enters the brain and activates the pleasure centers of the brain. So after that nicotine level depletes, it can really cause the body to have a strong visceral reaction to craving nicotine. And this cycle is really powered by the body's biological reaction to nicotine and isn't at all controlled by the person using the product. They really lose control over their body. When we look at the behavioral aspect of tobacco and nicotine dependency, we're thinking about an automatic and a chronic behavior. Again, feeling like they don't have control over their behavior. Oftentimes when we're working with someone that's trying to quit, they sometimes don't even realize how often they might be using their vape or e-cigarette device, or have a feeling like they just can't get going in the morning or relax in the evening without that cigarette. Oftentimes, we see that people use these products as a coping mechanism to deal with stress, anxiety, and other strong emotions. They're using them to self-medicate underlying conditions. It's really important to keep that in mind when we're trying to help people quit. There's also really strong sociocultural aspects to this behavioral part of the addiction. Oftentimes, we see that people are influenced by their peers, by their parents, and other family members who use tobacco and nicotine-containing products. It becomes part of a social and cultural construct and their practice to bond with others. We see this when we see people taking breaks at work to have a cigarette together. We see this after eating at bars and parties, amongst gathering of friends. It becomes a real ritual or an expected behavior. And this is how it can become so difficult for people to quit if they don't have the right support systems in place to quit. One of those really important support systems that I want to talk to you about is medication-assisted treatment. Quitting a tobacco product or a nicotine-containing product can be incredibly difficult, and it's important to utilize all of the resources we have at hand to help support someone who's going to quit or is going nicotine-free. FDA-approved medications have been shown to be safe and effective in treating adults with tobacco and nicotine use dependency. Treatment will vary depending on the individual's level of nicotine tolerance. That tolerance increases over time, so users tend to increase the amount of nicotine they need to receive the same biological effect. Treatment will also vary on the individual's experience of recovery symptoms and cravings. So notice I said recovery and not withdrawal symptoms. It's very important when we're helping someone quit that we frame this as their recovery. These aren't just withdrawal symptoms, they're recovery symptoms. They're getting healthier each and every day that they are staying quit. Nicotine replacement therapy. I'd like to talk to you about nicotine replacement therapy. Nicotine replacement therapy, or NRT for shorthand, is an FDA-approved medication. And these medications provide small, steady doses of nicotine to help stop those recovery symptoms and relieve the withdrawal. Different forms include nicotine gum, the nicotine inhaler, nicotine nasal spray, lozenges, and patches. Some of these medications are available over the counter or others by prescription only. These medications do not contain the other harmful chemicals that are found in commercial tobacco and nicotine products. The graph on your screen right now is an important one to keep in mind when we're thinking about how NRT helps people recover and quit tobacco and nicotine-containing products. I'd like to go back and talk really quickly about the variety of nicotine-containing products on the market. And really the way that they affect the body relies heavily on the way that the nicotine enters the body. So when we think about products like cigars, cigarettes, e-cigarettes or vape or hookah, those are all products that are inhaled, which brings the nicotine into the lungs, which then sends the nicotine directly to the brain. This entire process takes about 7 to 10 seconds, giving the person using these products a quick buzz from the drug. Other products allow the user to absorb nicotine into the body through mucous membranes. So if you touch the inside lining of your cheek with your tongue, you can feel that membrane, and that really allows substances to enter into the bloodstream. So when people use products like chewing tobacco or snus, those nicotine-containing products enter into the bloodstream through the mucous membranes and, right up into the brain again. So the process of absorption through mucous membranes is a little bit slower than when someone inhales the nicotine. It takes about 10 to 20 seconds to create that strong, intense nicotine buzz. So the graph on the screen really depicts the plasma nicotine concentrations that are achieved with these various products. So again, we'll see with that green line, that's someone using a cigarette. We see an increase, very steep increase in amplitude of nicotine delivery, and then it quickly depletes. So this is what causes that urge to continuously smoke or vape. We see with other tobacco products like that moist snuff or dissolvables that are entered into the bloodstream through the mucous membranes. It's a slower, less intense uptake, but it still steeply declines after that initial intake to the brain. So what we see here when we're looking at how NRT is delivered, we can see the comparison here. So NRT provides a less intense, but more modulated effect of the drug. So this helps with those with recovery symptoms, with the withdrawal symptoms. It's not as intense, but it does last longer in an effort to help keep people away from the product that we're trying to help them quit. Another really impactful part of using nicotine replacement therapy, or NRT, is summarized in this bar chart. And this is looking at the long-term or greater than 6-month quit rates observed with different NRT products, as well as the 2 prescription non-nicotine containing medications, which are bupropion and varenicline. So these data derive from 145 different randomized controlled trials. Therefore, it's inappropriate to compare the active medications with respect to clinical efficacy. What this chart does illustrate, though, is that the quit rates from each of the methods is approximately twice that of its corresponding placebo-controlled treatment arm. So it's really important, though, that we're looking at both the physiological and the behavioral aspect of nicotine and tobacco use dependency. So that's why it's incredibly important that behavioral counseling is used in conjunction with any of the 7 FDA-approved medications. As I mentioned before, quitting tobacco or nicotine products is incredibly difficult, and it's important to utilize all of the resources we have available to help support someone who's quitting or going nicotine-free. On the screen is a really comprehensive treatment approach, which includes use of those 7 FDA-approved quit medications and one of the 3 forms of evidence-based behavioral change counseling that we know works to help people quit. And now Natalie's going to talk a little bit more about nicotine replacement therapies, what's available, how they can be most effectively utilized, and how the people you're helping to quit can access them here in New Mexico at little or no cost. Natalie?
Awesome. As you heard from Rebecca, quitting is a multi-layered process. It takes both behavior change and medication-assisted treatment to be successful at quitting smoking. The 2 together also increase the chance of a person to stay quit. And that's what's important in this training, is that you understand that the nicotine replacement therapy is just one part of it, and there's a multi-layered process. So we want to make sure that we're working in conjunction with the other behavioral health assisted processes that we have for individuals who smoke. Now let's jump into the medication assisted treatment for tobacco use dependency. So medication-assisted treatment for tobacco use dependency. Treatment can include the use of FDA-approved treatment medications, but a thorough assessment of each individual is important to identify what might be the most appropriate. As we identify appropriate dose based on the level of nicotine tolerance. Tolerance increases over time. And with that amount of use, oftentimes we see that people are not dosed at a high enough level of nicotine replacement therapy to offset the physiological withdrawal or recovery symptom. So as you can see, assess for appropriate treatment and recommendations can happen intake. So if you're speaking with them, you're going to be asking them how much they're actually using, and we'll go over that later, so that we can actually make sure that the treatment that we're giving them matches the amount, and that way their cravings aren't as high, and so they're not smoking, but they can curb those cravings because, as you know, tolerance, as it rises, we need more nicotine to help with that tolerance. So we want to make sure, the cool thing is you'll learn that we can actually put two together to help with that. And there's some fast acting and slow acting ones. We'll go over that a little bit later. But that allows you to tailor the treatment plan to address each person's recovery needs. And so let's get into it. So medication assisted treatment for tobacco dependency, there are several medication assisted treatments that can be utilized for tobacco use dependency. These medications can be used together to support the client with withdrawal. So you can see there are some pictures here. We're only going to go over a few of these today, not every single one of them. However, if you go to CDC's website, you can go on their website. It'll tell you exactly what the dosage would be for each individual. A lot of these are over the counter, and so they're easy to get. Some of them are prescribed, and we'll go over how you can get the prescription later on for the client or for the individual you're working with, or how to refer them to someone who can get them what they need. But if you see here, we have mouth strips, nasal spray, micro tab. We have the patch. Most people are aware of the patch. We have gum, lozenge, inhaler, and then we have the mouth spray as well. So as you can see, there's a plethora of different ways that individuals can get their medication to help them. So kind of going over the cycle, and I know Rebecca went over this just a little bit, but the cycle of addiction is the reason individuals continue to smoke. Over time, each cigarette, the individual builds a chemical dependency. So every day that someone uses a tobacco product, they build a dependency on nicotine through the cycle of addiction. And here's how the cycle works. So after the smoker takes their first puff of a cigarette, nicotine is delivered to the brain only 7 to 10 seconds after that puff. That nicotine acts on a certain receptor in the brain, releasing hormones and neurotransmitters, including dopamine, norepinephrine, and serotonin. Smokers feel pleasure, the reduced tension, appetite suppression, and enhanced performance. So nicotine will accumulate in the body, and each additional cigarette creates greater tolerance. So the brain's chemistry changes and tolerance develops. Absence of nicotine causes withdrawal and then recovery symptoms. As the day goes on, smokers are going to need more and more cigarettes to relieve the withdrawal and recovery symptoms because the tolerance is getting higher and they're going to need more. So overnight, diffusion of nicotine throughout the body helps the smoker regain his or her sensitivity to nicotine. And then you've guessed it, the cycle starts all over again. And so we have this beautiful chart that explains that. The tobacco product delivers the nicotine, it hits the brain. The nicotine produces the sense of pleasure and reduced tension. And this is mostly when we hear people say, well, I'm stressed out, so I need a cigarette and it helps me with the stress. And at first, yes, it does. So we would never claim that cigarettes do not lower anxiety and stress. But here's what happens is the brain chemistry needs more tolerance. And so the stress is getting higher and higher and higher, the tolerance higher. So they're needing more in order to change and to get that, satiate that pleasure. And then, so that's where they get the withdrawal symptoms and recovery. And then overnight, the nicotine throughout the body becomes sensitive. So in other words, they're overnight, their withdrawal symptoms kind of go down and their addiction goes down. But in the morning, when they hit that first cigarette, they're looking for that pleasure, like it says 5 to 7 seconds, it hits it and it gives them that pleasure sense. So I think really what we're looking at is the nicotine produces sense and pleasure is really what we're looking at. When are they going for that cigarette in the behavioral, but also when we're doing intake to find out, you know, when is it that they're having the cigarette? And that's going to be a question that is asked, or vape as well. That's going to be asked when you do intake, so you know what type of medication to give them, because each one of them delivers a different onset, or how much is delivered at and at what time. So it could be slow or fast. And so that's going to be an important thing to ask. and then the cause of withdrawal. So we want to make sure they're not experiencing the withdrawal throughout the day. And that's going to be why we're going to need to pair it up with different medications, the nicotine. So what is nicotine replacement therapy? So it is, NRTs are medications that contain nicotine. And there are 7 FDA approved quit medications, 5 which contain nicotine, and then 2 that are non-nicotine prescriptions medication. And then we'll tell you how that they can get their prescription as well. The 5 nicotine replacements include nicotine gum, lozenge, patch, and nasal spray. And we'll go over those in a minute. Nicotine replacement are more effective if utilized with behavior change. Again, coming back to the behavior change, it's really important that you understand behavior change is critical part to this as well, as there's the mental piece and also the physiological piece as well. And sometimes behavioral is a little harder to overcome. Nicotine replacement therapy come in different dosages, and we'll go over the dosing in a little bit. Nicotine replacement is very safe medication to treat tobacco dependence. It has very few side effects. Nicotine replacement therapy has no interaction with the psychiatric medications. They can be taken in combination, but the use of bupropion and nicotine replacement tobacco cessation may increase hypertension. FDA will still approve it in combination with nicotine replacement therapy. Nicotine replacement therapy can be used with individuals with stable cardiovascular disease, but nicotine replacement therapy should not be used within 2 weeks of a heart attack, or they have serious abnormal heart rhythms and severe angina. So again, letting them know this is something that if you don't feel comfortable telling the client or not sure if they're having heart conditions, obviously you can have them talk to their physician to see what would be the best approach. So we're going to look at the patch, or the transcendermal nicotine patch, aka patch, long-acting, slow onset, and we'll go over what that means. Constant nicotine level helps avoid withdrawal. It's simple to use, and the user has no control over the dose. So I'm going to give you some very long information. So nicotine patches provide a slower, steady level of nicotine over a longer period of time. However, faster acting types of nicotine replacement therapy, which include mouth spray, gum, lozenge, and inhaler, with the delivery nicotine more quickly than nicotine patches. So it's a very slow onset. It doesn't happen right away. So as we said, like the 5 to 7 second rule of the delivery of the cigarette, it's not going to really help with that craving right away. So this is more for those cravings that come after. So many people who smoke will need what's called combination replacement therapy, patches plus a faster acting type of nicotine replacement therapy, like the mouth spray, lozenge, gum, inhaler. That way they have a steady level of nicotine for the day, plus a bit extra at times when they would normally smoke. So you just really want to make sure, and that's why it's really important to find out kind of what their habits are when it comes to smoking, so that you kind of can give them a better combination. And that way they are not having the withdrawal as much, and they're more successful. So nicotine is absorbed through the skin, okay, and it's absorbed about 1 to 4 hours after it's actually applied. The highest level of nicotine absorption after 3 to 12 hours for various brands. And then they can wear it throughout the night unless they're experiencing sleep problems. They can actually take it off and then reapply it in the morning. You can purchase without a prescription, so it is over the counter, and you cannot cut in half because it would lead to overdose, and because the skin really absorbs it and it can be toxic. So a new patch must be applied every 24 hours, okay? So the nicotine patch is typically worn for 24 hours. The patch can even be worn when showering and bathing. Upon waking, the client will want to put on a fresh patch on clean skin and wear it for a full 24 hours. If the client is having vivid dreams or sleep is disturbed again, they can take the patch off before bed and then again put it on in the morning. So the dosage for the patch, so we see that there's different ones. There's 21 milligrams, and and the duration for 6 to 8 weeks is how long they want to use it. 14 milligrams, 2 to 4 weeks, and then 7 milligrams, 2 to 4 weeks. And you can see the person who smokes a pack a day, or a person who smokes 7 to 15 cigarettes, and then a person who smokes less than 7 cigarettes a day. If a person does smoke 2 packs a day, they can start with 21 milligrams to 21 milligrams a day, but you want to actually lower that as time progresses. So for the best results, make sure you start on the right dose, or have them start on the right dose. The nicotine patch comes in 3 strengths, as we show here. The right dose for the client depends on how much they currently smoke. If they smoke more than 10 cigarettes per day, consider starting on the 21 milligram patch. Don't wear 2 patches at once unless directed so by the healthcare provider. So as I stated before, that you can put 2 patches on, but they might want to consult with their physician over that. Over time, typically after 8 to 12 weeks, you should lower the dosage with the goal of stopping use of the patch completely. So the deal here is that we want them to actually get off the nicotine or lower the nicotine usage so that they can quit. So what about vaping? People who have been vaping may have been exposed to a higher nicotine dose than traditional cigarette smokers, and so high dose of nicotine replacement may be needed. Patches can be combined with a second form of nicotine replacement, such as gum or lozenge, to be used necessary to combat breakthrough cravings. Keep in mind, nicotine replacement therapy is considered a first-line treatment for most people who want to quit attempt. And if it is available over the counter for adults, or by prescription for children under the age of 18. So studies have found that while smokers are often successful in switching to e-cigarettes, very few are able to stop using the products. Okay, this is predictable because the higher doses of nicotine delivered by e-cigarettes can effectively surmount nicotine tolerance, satisfying the drive for a nicotine buzz. So switching to e-cigarettes would only be harm reducing if the product causes less health damage than traditional cigarettes. Again, nicotine replacement therapy is considered the first line of treatment. So it's not FDA approved. There has been no research that has found that it supports. And we know that e-cigarettes actually deliver more nicotine and cause a higher withdrawal for the individual. So make sure that when you're talking with people who are doing e-cigarettes, that's not recommended. And now you kind of know why, and there's more information that could be found on CDC's website. So how to place the patch, and this is really important, and this is recommended by CDC, because if it's not placed properly, they won't actually receive the actual nicotine through their skin into the bloodstream properly. So they will want to put the patch on a clean, dry, hair-free skin on the upper body. Usually, the usual places to put the patch are in the upper chest, the upper arm, the back, or the inner arm. So they want to avoid putting the patch on areas of irritated, oily, scarred, or damaged skin. The client's going to remove the patch from the foil package, peel it off, the protective strip, and immediately apply the patch to the skin. They will want to press down to ensure that the patch sticks to their skin. They will need to wash their hands with soap and water after they apply the patch. To wash away the nicotine they may have gotten on their fingers when they apply the patch. To avoid skin irritation, they'll want to put the patch on a different area of their upper body. They must avoid wearing the patch in the same place more than once per week. So they're going to want to be changing the patch up, and that's something you want to let them know. The patch loosens or falls off, they can replace it with a new one. When changing their patch, they will want to remove the patch carefully and dispose of it by folding it in half with the sticky sides touching. Then apply a new patch on a different part of the upper body. This information can be found on CDC's website as well, but just so you know that it's really important that they are replacing the patch, that they're moving it, and that they're washing their hands. That's the most important thing after, because it can still get into the skin. And so we want to make sure that we wash off that excess nicotine. Moving along. So now we have the oral, and that's gum and lozenge. Nicotine blood levels fluctuate when they do this, and requires training for proper use and user control dose. So Again, I'll go over that with you. For best results, make sure they start with the right dose. Again, you're going to want to ask them how much they're smoking, and this can be used in combination with the slower onset patch. So we'll go over how this is a more fast-acting nicotine replacement therapy. So the nicotine gum comes in 2 strengths. It's 2 milligrams and 4 milligrams. The right dose for the client depends on when they usually have their first cigarette each day and how much they're currently smoking. So that's the most important thing to understand. If they have their first cigarette within 30 minutes of waking, they should consider starting with 4 milligram dose. Over time, typically between 8 to 12 weeks, they can lower the dose, and how often they use it until they stop using the gum completely. So again, you want to make sure you use it in combination, and you want to make sure that you know how fast they're smoking so that you know how much to give them. If they are, because of the 7, as we said, 5 to 7 seconds after they smoke their first cigarette, they get that buzz. So they're going to be craving it. So this is a more fast acting nicotine replacement therapy, and it'll hit that faster. So they won't have that craving as much. And then with the patch, the withdrawal will help with the patch. So you can kind of see how the combination works together. They can use 1 piece of gum every 1 to 2 hours for the first 6 weeks of their quit attempt. They will want to think ahead about when they might have a craving for a cigarette and then use a piece of gum before the craving happens. So this is something that, for instance, if they're out, let's say they go out to a party or they're with friends, or they, something's going on, they're going to want to be prepared. And this is something you're going to want to let them know, because sometimes in social settings, it kind of triggers that, or even with food, sometimes after people eat, that it triggers that. So they need to kind of know their triggers. That way they can have their gum on hand, so that then they can let that go through before they want to go and grab an actual cigarette. So to ensure that their body gets enough nicotine to ease the withdrawal symptom they may be feeling, it's best to use at least 9 pieces of gum per day for the first 6 weeks. If they are using the gum along with nicotine patch, they may not need to use the gum as frequently, because they will use it when they get or expect a craving. And they should not use more than 24 pieces of gum per day. Following 6 weeks of use, you can reduce the use to 1 piece every 2 to 4 hours, and then 1 piece every 4 to 8 hours. If they use fewer than 10 cigarettes per day, or do not smoke every day, have them talk with their doctor or other healthcare provider about dosing. They may want to start with a lower dose and then use gum less frequently. They should not eat or drink for 15 minutes before or during use. Food and drinks are acidic, such as soda, coffee, and can stop the gum from working as well. So please let them know that. So nicotine gum is not like regular chewing gum, and that's something that you don't want them to just put it in their mouth and start chewing, because they can be getting way too much. So there's a proper use, and so to use it correctly, they're going to bite down slowly on the gum until they feel a tingling in their mouth. And then they're going to do what's called parking it. They're going to park the gum between the inside of their cheek and their gums. And they're going to hold it for a minute to let the nicotine absorb into the body. Then they'll repeat this chew and park process until the tingling stops. So it's usually about 30 minutes. Occasionally changing where you park the gum in your mouth. So like we take the patch and we move it around, we're going to do that with the gum. So they're going to chew it, tingle, park it. And so they'll park it up in between their gums and their mouth. And we want to make sure that they understand that, because they can be giving themselves way too much nicotine all at once. Again, for the best results, make sure they start on the right dose. And this is for the lozenge. The lozenge is almost similar to the gum, but a little bit different. So the nicotine lozenge comes in 2 sizes. They have a regular and a mini, and each size comes in the 2 strengths as well. So it's not a different dosage. So 2 milligrams and 4 milligrams as the same as gum. The right dose for them depends on when they usually have their first cigarette again each day and how much they're currently smoking. If they have their first cigarette within 30 minutes, of waking, they should consider starting with the 4 milligram dose. If they are using the lozenge along with a nicotine patch, they may want to start with 2 milligram dose. So over time, typically after 8 to 12 weeks, they can lower the dose and how often they use it, with the goal of eventually stopping and using lozenge completely. And stopping the lozenge completely. They will use 1 lozenge every 1 to 2 hours for the first 6 weeks of their quit attempt. Again, make sure that they think ahead when they might have a craving for a cigarette. So it's kind of the same thing. And then have them use a lozenge before the craving happens to ensure that their body gets enough nicotine to ease the withdrawal symptom. It is best for them to use at least 9 lozenges per day for the first 6 weeks. So again, the big thing that I want to say on this piece before I move on is that it is super important, critical that they understand when they get their cravings, because they want to make sure that they are prepared so that they don't go back into smoking. And that's the way it's going to be successful. So I would highly, highly recommend that they, in the behavioral piece, they can kind of look at when they feel they're going to actually have a craving. Or you might want to ask them to write that down and kind of track when they feel like they're having a craving. Again, it could be when they're in a social setting, or perhaps when they're after they eat, or when they're stressed out, or when they get to work, or when they want to take a break. So that if they kind of understand when that's actually happening, then they're going to be more successful, and they can take that with them so that they can make sure they have what they need. If they're using lozenge along with a nicotine patch, they may not need to use the lozenge as frequently, because they will use it when they get or expect a craving. They should not use more than 5 lozenges in 6 hours, and should not use more than 20 lozenges per day. So after 6 weeks of use, they can reduce the use to 1 lozenge every 2 to 4 hours, and then 1 lozenge every 4 to 8 hours. If they use fewer than 10 cigarettes per day, or do not smoke every day, have them talk with their doctor or another healthcare provider about dosing. They may want to start on a lower dose and use less lozenge less frequently. They should not use more than 1 lozenge at a time, and should not use one right after the other. This could cause side effects like heartburn and nausea. So just make sure that they're not overdosing on that. They should not eat or drink, again, 15 minutes before using, or while the lozenge is in their mouth. So food and drinks that are acidic, such as soda and coffee, again, can stop the lozenge from working as well. Nicotine lozenges are not like regular lozenge. To properly use, have them put the lozenge in their mouth between their gum and their cheeks, so almost like the park technique. They may feel warm, tingling sensation. They can allow the lozenge to dissolve slowly over 20 to 30 minutes, moving it around every so often from side to side. And they should not chew, suck, or swallow it. So that might be a little bit more difficult, and that's why it's important to kind of ask them, because some people have a tendency to want to chew or to swallow or dissolve faster. So I think it just requires a little bit of patience as it dissolves in the mouth. So just let them know that they can just park it, and then make sure that they're moving it like the gum as well. Again, this information can be found on the CDC website. So I highly recommend that you just kind of go through, read through as a reminder. You can also get these slides with the information and notes on them as well, if you're interested. Now let's go over the nasal inhaler. They're called inhalers or puffers. Nicotine blood levels fluctuate and requires training for proper use. For this one, the client will need a prescription from the prescribing healthcare provider for the nicotine nasal spray. What's exciting about New Mexico is pharmacists in the state of New Mexico can actually prescribe nasal spray, which we'll go over a little bit later. To use the nasal spray, the client must first blow their nose to ensure it is clear. So they want to make sure that their passages are clear so that they can inhale it. They will tilt their head back slightly put the tip of the bottle into their nostril as far as they can feel comfortable. They will breathe through their mouth, and then they will spray each nostril. So they should not sniff, swallow, or inhale while spraying. If their nose runs, then you're going to have them gently sniff to keep the medicine in their nose where it will be absorbed. They will have to wait at least 2 to 3 minutes before blowing their nose. So just making sure that they're, allowing it to go if they have to put their nose back. Once they are finished, they will put the cap back on the nasal spray and store it out of reach of children and pets. Especially this one is important. All of them are actually important to keep out of the reach of children and pets. One bottle of nasal spray typically delivers about 200 sprays. During the first week, most people experience a hot, peppery feeling in the back of their throat or nose, as well as sneezing, coughing, watery eyes, or runny nose when using the nasal spray. These symptoms should lessen after a week of regular use. Have them contact their doctor or other healthcare provider if the symptoms are particularly bothersome or do not go away. They can use the nicotine nasal spray often enough as directed by their doctor or other healthcare provider to help control the cravings for cigarette. One dose of nasal spray is 2 sprays, so 1 in each nostril. To ensure that their body gets enough nicotine to ease their withdrawal symptoms, it is best that they use at least 8 doses per spray or per day, for the first 6 weeks. They should not use more than 40 doses per day. People typically start with 1 to 2 doses per hour. Their doctor can help them set and adjust their dose and can talk about gradually reducing their dose when they are ready. If the bottle breaks or leaks, they must wear rubber gloves to wipe up the liquid with a paper towel and wash the surfaces thoroughly. This is highly important because nicotine is highly toxic and the juices are highly toxic. So again, if the bottle breaks or leaks, they must wear rubber gloves to wipe up the liquid with paper towels and wash the surfaces. They should not let the liquid come into contact with their skin, mouth, or eyes. If it does, they need to rinse with plain water immediately. Nicotine overdose can occur when nicotine is absorbed through the skin, which is why we don't cut the actual patch in half as well, because we don't want that seeping into the skin. It's highly toxic. So this is something that's very, very important to let them know. So it's important. So we've just gone over that. Now, how do we get our nicotine replacement therapy for your clients or patients, and how do you talk to them about where they can possibly get nicotine replacement therapy? So let's go over. New Mexico offers comprehensive treatment for Medicaid enrollees of all 7 FDA-approved medications. Cessation counseling is covered and includes multiple types. So again, the behavioral health, I want to keep coming back to that, the behavioral health. And if you didn't watch the other training, please do, because we need both in order for an individual to stay quit and to be successful at their quit attempt. Medicaid enrollees have nearly doubled smoking rates of the general population. Smoking cessation coverage in New Mexico includes medications such as varicocilin, bupropion, nicotine lozenges, nicotine patches, nicotine gum, nicotine sprays, and nicotine inhalers. It also includes individual counseling, group counseling, and cessation quit line. So the counseling is just as important as the nicotine replacement therapy, if not more important, because after the cravings go away, the behavior is sometimes harder to change. Quit rates increase when clinicians and healthcare providers consistently identify and treat the patient's tobacco use. Even brief counseling, such as is effective for facilitating quit attempts. If a provider chooses to counsel recipients in their office, the New Mexico Medicaid program covers tobacco cessation counseling. So it is covered by Medicaid. Cessation counseling services may be provided by or under the supervision of a physician, by any other Medicaid enrollee healthcare professional authorized to provide other services in the Medicaid program, who is also legally authorized to furnish such services under New Mexico state law. Generally, this would include medical practitioners, including independent independently enrolled certified nurse practitioners and behavioral health and dental practitioners. Physician-assisted certified nurse practitioners are not enrolled as independent providers. Registered nurses and dental hygienists may bill for counseling service as well when under the supervision of a dentist or physician. Although counseling services must be prescribed by a licensed practitioner participating in New Mexico Medicaid program, the services do not require prior authorization. And if you're looking for more information, you can visit the American Lung Association's state coverage database for more information on that. And also the state. So what I love is that we ourselves here in the state, we have 1-800-QUIT now. It's a national quit line, but it's in the state, you can call 24/7, and they get personal quit plans, self-help materials, unlimited sessions with a trained quit coach, and they also will supply, depending on how much on intake, if they determine that they need support with nicotine replacement therapy, they can provide that. Gum, patches, lozenge, while supplies last. They ship it mailed directly to the registered participant. Specialized services for youth and pregnant women as well. Also working with the team, with a quit coach, you'll quit at your own pace, conquer your urges to smoke, use quit medications. They do really work. Not just quit, but become a non-smoker, which is really what we're aiming for, is that they stay quit, which is why we provide so much support in the both behavioral and the nicotine replacement part. And then utilize a program. It's a program that's been based on 25 years of research. So we know that the nicotine replacement, along with the behavioral health or behavior change, is the key to helping someone stay quit. Again, call 1-800-QUIT now, or have them go to quitnow.com. And you also, we go over this a lot in our other training, but you can go onto the website. There are other trainings on there that you can do as well. And there's a lot of information on how to support the individual. And you can also refer them to this as well. And they can set up a quit coach. They can do web-based, they can do text messages, they can do a call, whatever's needed for the client to actually be successful and stay quit. So pharmacists increasing access to tobacco cessation treatment. This is really awesome. New Mexico is one of the first states to permit pharmacists to prescribe tobacco cessation medications under a statewide protocol in 2004. That is really awesome because it makes it very easy for an individual to get their prescription. As I said, the nasal spray, and there's a couple of others that need prescription. And so they can actually go and talk to the pharmacist. So if you are referring a client and you're like, I have no idea, I took this training, I kind of know a little bit, but I don't feel comfortable, you can actually refer them to a pharmacist. And that would be awesome because as you can see, 91% of Americans reside within 5 miles of a community pharmacy, which is pretty awesome. Prescriptive authority of pharmacists leads to improved public health access points and outcomes. Because of their accessibility and expertise, pharmacists are well positioned to help their patients quit smoking. And research shows that they're good at it too, which, I mean, they're working with medications all the time, so it makes complete sense. In 2014, New Mexico study demonstrated that pharmacists provided tobacco cessation services are just as effective as those provided by other healthcare practitioners. That same study in 2014, which included 1,437 participants, also highlighted pharmacist accessibility. 64% of the participants did not have health insurance and thus were unlikely to receive cessation services from another healthcare access point. In addition to the positive findings, there have been no reported problems related to pharmacists' authority to prescribe these medications. So across the US, states are recognizing the value of authorizing pharmacists to prescribe in order to increase access to important medications. This authority exists somewhere along a continuum and is either dependent or independent. And so directly from the state, no delegation or required or authority. So it's really important that you know this. I think it's a very great option to give the individuals that you're speaking with. And if you, again, don't feel comfortable with the dosing or telling them how much the client should have or need, you can refer them to the 1-800-QUIT now for the nicotine replacement therapy. But you can also refer them to a pharmacist if they want to talk to someone in person and they need a prescription medication. So pretty awesome, I think, of New Mexico that we're doing that. And I think it's super helpful that we are doing that. So this concludes our training today. It was such a pleasure being with you, and I look forward to the great work you will provide throughout the state of New Mexico. Please visit our website for other trainings and CEU credits available to you. As I said before, I would take the behavioral health one that coincides with this one. And then also, if you please scan the the QR code or visit our website to take the evaluation and request your CEU certificate. I am so excited to see the great work you're going to do. It's been such a pleasure. I hope that you enjoyed this presentation. And if you need any support, please reach out to us. Thank you and have a beautiful day.